Hi.
3-year anniversary, 2-year anniversary, and 1.
Oh yeah, we'll do
Yeah,
that.
3, 2, 1. There you go.
Yeah. This is my second year here in this building. My name is Destin Radder. I am the acupuncturist. I have been in this area since 2010, but yeah, I've been in this area this building in the last 2 years, and this is unexpectedly become kind of wellness row. Which is really nice because I keep on saying to my patients all the time that when you're trying to repair your house, do you only use a hammer? Do you only use a screwdriver? Do you only use a saw? No, you have to use all of them. So when people need, when sometimes people are it's unexpected that there's not that one cure-all, there's not that one fix. And I really try to encourage people to go to a chiropractor, go do some yoga, move, because there you will often need more than one thing to help you get back on track. I am, like I said, an acupuncturist. I've been an acupuncturist since 2007. Acupuncture is part of Chinese medicine, which has a long history of about 3,000 years. And really, when I talk about Chinese medicine, what I really try to stress is that it's not as weird as it seems. It's really just looking at the body from a very different point of view. And like I was just telling someone earlier today, 3,000 years ago, there was a great need to help people get better. And Chinese medicine came from a different culture, and they just naturally looked at the body a different way. And often I like to say that if you have a very hard problem that you can't get over, what's the first thing you usually do is you ask a friend that has a different perspective, has a different history, has a different lifestyle, and who knows different things, and they can usually give you, they might not always have the answer, but they can sometimes give you some insight. And I think about that as about that when it comes to healthcare and anyone, and I think this event was very much for displaying the many options and many different perspectives. I have a tendency to roll on and on and on about acupuncture, but I find that there's usually a few questions that people have, and I'll just answer those right off the bat. Number one, what's it good for? Acupuncture is great. Well, over 3,000 years, Chinese medicine has pretty much seen almost everything that can go wrong with the body. Everything from infectious disease to traumatic injury to chronic issues to pregnancy and childbirth, geriatric diseases, menstrual issues. But I think really the question that needs to be answered now is, how does Chinese medicine fit into the modern medical system? And I think the main categories that it really helps are pain, chronic pain, acute also, but a chronic, especially when the treatment protocol is just pain management with pharmaceuticals. When you get to that point where you're like, all we can do is give you painkillers. And actually, I think all three of us are pretty good at that. That very same thing. Digestive issues. Chinese medicine has a really good success rate with anything from IBS to Crohn's and colitis and acid reflux. And I actually had a doctor come in to me one time that wanted to get off acid reflux medication, which I thought was really ironic. But he's like, I give this out all the time. I don't want to be on it. And I thought it was like I wanted to freeze that moment in time. Like, wait a minute. There's a doctor who doesn't want to get pharmaceuticals who's coming to the acupuncturist. This is like a sitcom right here. And a third thing that Chinese medicine is really good at is menstrual issues, regulating periods, great for pregnancy, morning sickness, just continuing, just getting, just taking care of the weekly aches and pains and things that happen. I have pregnant women that come that just every week, one week it's their hip, the other week it's the back, the other week it's something here or there, and just kind of keeping everything going. And also just chronic health issues, where you go from doctor to doctor to doctor to doctor, and nobody really has a clear view. And there's a lot of times where people will come and they'll say, I have nobody can give me an answer, and I'll go through their symptoms, and they'll just fall right into a classic Chinese medical diagnosis, and that's just I think the manifestation of just a different perspective. The second question is, does it hurt? Which unfortunately there is no answer to that question, because everyone's different. I have some people that are very, very sensitive. I have other people that I could probably pound nails into them and they wouldn't even flinch. Different parts of the body, forearms and calves are not as sensitive. If you get into hands and feet, they tend to be a little more sensitive. I do a different kind of acupuncture where I really only needle from elbows down and knees down, and that's it. And through through that technique, you can access anywhere in the body. So I do not needle where it hurts, and that's where a lot of people are a little nervous. Like, if your back is hurting, do I really want a whole back full of needles? And I do a technique where you don't do that. And so sensitive areas, like a lot of people, if they have sinus issues, traditionally you go into the face, which is very sensitive. I don't have to do that. So the answer is, it depends. Some people, they don't really, it doesn't really matter. Other people, they're a little more sensitive. But either whatever, I try to work with whatever your sensitivity level is and make you comfortable no matter what. But usually once the needles are in, very typically it's just like a little pinch, and a few seconds later it all goes away. And then when I'm done, you're in a nice room with some calm music and lights are low, and most people are snoozing actually. When I walk in, I catch them snoring. So it doesn't seem like you can relax with a bunch of needles in you, but people do really come just for relaxing. Third question, does insurance cover it? Unfortunately, not really. No fault does. If any car accidents, if you have a car accident, acupuncturists can use no fault and can bill no fault. I entered into a couple of programs with United Health and Independent Health where there's a discount, 20% discount. But other than that, there's really not many insurance companies that cover it, unfortunately. But everyone's coverage is different. Every employer negotiates a different contract, so I often tell people to call and try to confirm. See, those are probably the most common questions. And I think it's a great. I think acupuncture, along with yoga and chiropractic, which I personally use all of these modalities, are a great strategy to try to get you over any healthcare issues that you have. Thank you, Ren.